As we finished unit 1 and 2, we are moving on to the unit 3, that is regulations related to the healthcare waste. So what regulations are there, and what are the regulations that internationally followed, as well as what regulations are there in the India according to Indian scenario. We will see one by one. First thing, so why the regulations are very, very important? What does it mean by regulation? There are certain rules and guidelines we need to follow. So here, the healthcare organizations that follow the biomedical waste management rules and regulations, which are given in 2016, as amended from time to time, means the changes are happening time to time according to the trends that are occurring in the healthcare and related to biomedical waste as well. So there are various provisions were made and maintained in the records and registers, barcode systems, reporting. So so what does it mean by the rules? The rules where we need to apply. Okay, so the rules are or guidelines need to be applied not only in the process of waste production and waste collection and storage and the disposal and treatment, but the rules and regulations and guidelines to be followed even during the process of reporting, recording, as well as in following the barcode systems, which are given by State Pollution Central Board. Okay, the rules and regulations are given by the State Pollution Control Board. So we will see one by one. Legal framework relating to biomedical waste management as the first one. Next. Okay, so here under the legal framework of relating to the biomedical waste management, it is the waste that is getting produced out of any hospital that we previously also have seen. It is among 10 to 25% is hazardous waste, whereas 75 to 85% of waste is non-hazardous waste. Okay, so here the physical, chemical, microbiological risks to the public health as well as health care workers and around the general public and the environment, there is only a 75 to 95% chance out of the waste that is coming out of the hazardous waste. Like there is a 10 to 25% of the hazardous waste, there is a higher chance of getting a contamination to the general public. So there is a proper way to dispose and treat. So that's the reason we need to follow to avoid that 80% of chance of getting a infection. Okay, so there are some international agreements and conventions are made as it is given. So there is back in June 2007, the fundamental principles regarding the safe biomedical waste management developed in World Health Organization. Okay, the fundamental guidelines have been made by the World Health Organization. There was a meeting conducted in Geneva. The concept was based on the efforts that are made for the proper resources and investment and management. So basically, what are the resources? It is like money, manpower, material. Okay, so basically in the first place, what kind of resources are we required in order to maintain this biomedical waste management, in order to apply these guidelines and framework? So it includes the finances, it includes the support, it includes the assisting in ensuring the safety of the healthcare workers as well as safe disposal of the waste. Okay, so on the other hand, there is a non-governmental organizations also should take part in similar way in conducting the activities and contributing their efforts in order to make the biomedical waste management is safe. Okay, so there are some global conventions have been made identified with the causes of biomedical waste management concerning the environmental protection, sustainable development, and putting the efforts together in maintaining the effective policies related to handling and management. So what are they? There are three basic conventions have been made internationally. Number one, the best convention on hazardous waste. Sorry, that is Basel Convention. So the basic or Basel Convention on hazardous waste. So comprehensively, we know that globally, the Inclusive Environmental Treaty, which says about 170 centimeters. I'm sorry, it's a retake. You can cut cheyandi meeru starting. Okay, globally there are three conventions have been made. That is, first one is Basel Convention on hazardous waste. Second, Stockholm Convention on persisting organic pollutants. Thirdly, Minamata Convention on mercury. So there are globally three conventions have been addressed and identified with the cause of biomedical waste concerning the environmental protection, sustainable development, as well as putting together the policies for effective handling and the management. So there are three, as I mentioned. Number one is Basel Convention on hazardous waste. Number two is Stockholm Convention on persisting organic pollutants. Thirdly, Minamata Convention on mercury. Okay, so first one is Basel Convention on Hazardous Waste. So it is most comprehensive, globally inclusive environmental treaty, which has about 170 countries as its members and aim to protect the environment and human health from detrimental impact of management. So according to Basel Convention on Hazardous Waste, they have identified which percentage is actually a hazardous waste and what kind of harms that can affect the human beings as well as the ecosystem. So where the membership have been taken by 170 countries, and main aim is to protect the environment and human health as well from a detrimental impact of the waste on the human beings. Okay, so second one is Stockholm Convention, persistent pollutants. It is the pollutants are nothing but which are coming out of the incineration, which are dioxins and furans. So there is a global treaty to protect the human health and the environment from the pollutants which are arising from the treatment of the incineration. Okay, treatment as an incineration. So there are chemically toxic elements which are released into the environment due to the incineration and combustion methods. So the larger they get accumulated in the environment, it becomes a fatty tissue and cause the damage to any other organisms. Okay, so here what are we trying to do according to the convention is we need to identify the source of production of that particular toxin. Okay, so the source have to be cut down. So which kind of what is a source? Incineration. So which kind of a waste that undergo incineration? We have seen that which is a the hazardous ones as well as the non-hazardous ones which cannot undergo the recycling process, like which cannot be undergone into the disposal or disinfectant or into the landfilling and burial. It need to undergo the incineration. So that particular source, the production of waste need to be cut down, and segregation and resource recovery, recycling, training and proper collection, transport and other best environmental practices need to be followed. And they have issued other ways of treatment also. Then Minamata Convention on Mercury is, as mentioned above, this convention is related to the similar objective of protecting the environment and human health as well. It suggests that a method of phasing out a certain medical equipment in healthcare services, including mercury containing medical items such as thermometers and blood pressure devices. How do we protect them? Okay, how do we prevent the spillage of mercury on the floor? How do we prevent the harm that is getting released or that caused by the mercury? Okay, so these are the conventions have been made internationally, and same thing need to be followed in all the countries who got the the authorization from the international agreement and the conventions. The next one is Indian scenario. Next. Okay, so according to Indian scenario, the first ever biomedical waste management and handling rules have been notified in India in July 1998. Okay, and it is given by the Ministry of Environment, Forest and Climate Change to oversee and monitor the proper way of waste disposal and biomedical and healthcare waste management in India. So these regulations are applied by anyone that helps in generation of waste, collection of waste, storage of waste, receives the waste and transport the waste and treat the waste. So all the people who are involved in these particular steps of biomedical waste management need to follow these guidelines. Okay, so the occupier with 1,000 beds, any hospital or any healthcare setting that contains 1,000 beds need to get a obtain or permission from this Ministry of Environment and the Pollution Control. So they have given certain rules here in the time span of 2022 to in the time span of 2002 to 2004, the existing biomedical waste measures, framework and practices were explored by the International Clinical Pathology I repeat, in the time span of 2002 to 2004, the existing biomedical waste measures and frameworks and practices were explored by the International Clinical Epidemiology Network. Okay, this is a board that takes care of releasing the authorities and prescribed authorities, advisory committees. Prescribed authorities and advice committees have taken a responsibility in giving the biomedical waste measures and how the framework and network has been done and how the practices need to be done. Next one, we have the Gujarat 2009 previous 240 people affected by the hepatitis B by used unsterile syringes. So this is also considered in order to make the guidelines. We are studying here the rules and regulations related to the biomedical waste management. So this is one of the fact. Okay, why we need to dispose the the waste after segregation. This is the one of the fact. So many people who did not dispose the syringe needles properly caused the needle stick injuries on sterile syringes through them, and there is a cross infection occurs. Next. Then we have the Central Pollution Board and State Pollution Board. Both the committees have the authority to cancel and consent to operate and authorize. So they have the permission, or they have the authorization to give the authorization to certain hospital or healthcare setting, as well as to cancel and to give the consent as well, where the healthcare institutions under biomedical waste management rules also been issued in 2016. Then also there is a failure to comply the provision of rules will attract the penal action. Okay, so any hospital or any healthcare setting that is not following the guidelines which are given in 2006, 2016, and which were established in 1998 also, they have the penal action, including the imprisonment for a period of 5 years and a 5 years of imprisonment along with the fine of 1 lakh. Sometimes the both. Okay, so these are the instructions and guidelines have been made in India. Okay, so next we have the rules which are given by Biomedical Waste Management Rule 2016. What are the rules have been given here? The Ministry of Environment and the Forest, both are the ones which are notified the Biomedical Waste Management Rules 1998 under the Environment Protection Act 1986. Okay, so the central government has published the biomedical waste management rules. They exercise the power controlled by conferred by the section 6, 8 and 25 of Environmental Protection Act 1986, and its suppression of biomedical waste management and handling rules in 1998, and further amendments also there too. Okay, it has been started in 1980 and continued even 1986 and then followed in 1998. The government of India decided in 2016, and they published a new set of rules and biomedical waste management rules 2016, and the same things which we are following right now, with the little amendments or changes that have been occurring according to the trends that are happening. Like example, COVID-19, which came in 2019, 20 and 22, new guidelines have been added, and that also we are following. Then supervising, the supervening the old one with the various changes and additions have been done. Okay, from the 1998 to 2006, from the 2006 to 16, there are some changes happening in all the steps, including the collection, storage, treatment, disposal, and everywhere. And we need to follow every hospital and healthcare setting which is getting authority by the pollution control body, need to follow all those things. Incineration, microwaving, autoclaving, and chemical treatment among the treatment technologies have been identified. So they are identified as the proper techniques of disposal, and we started continuing them in the biomedical waste management treatment. Next. Okay, they also have the prescribed authority for enforcing the provision of these rules in respect to all the healthcare facilities, especially the union level as well as in the state level. So they have the respective State Pollution Control Board, that is SPCB, and the Pollution Control Committee, that is PCC. So these are the two ones which are monitoring at the union level as well as the state level. In case of armed forces healthcare establishment under the Ministry of Defenses, they are taking the responsibility of that particular area of biomedical waste management. So the prescribed authority over that is Director General, Armed Forces Medical Services. They are the ones which prescribe the guidelines, and they'll also see that supervising the things in order to make sure the things are being followed. The duties of occupier or operator of common biomedical waste treatment facility, as well as the identified authorities and outlined in these rules. Okay, and according to these rules, any occupier or operator who handles a biomedical waste, regardless of the quantity, must obtain permission from an appropriate prescribed authority. So everybody who follows that particular guideline, they need to take a proper prescribed authority from these boards, which include State Pollution Control Board as well as Pollution Control Committee. Then these rules are divided into 4 schedules and 5 forms. So we will see. Next. Okay, so they are like the main goal of these rules is based on 3 R's, which includes reduce, recycle, and reuse. These are the 3 R's have been mentioned in the biomedical waste management way. reduce the waste, recycle the waste, and reuse the waste, which is reusable one. Okay, it aims to reduce the waste, recover and reuse as much as possible, and avoid the disposal. So rather than taking the end of pipe approach, waste should be readdressed as its source. So it's not like, as I said previously, that more than we focus on the treatment and the disposal, we need to focus on addressing the issue at the beginning, that is reducing the source and reducing the uh, production of waste. Okay, so these guidelines also helps in primarily addressing the application and implementation of rules and regulations for the benefiting of environment and the people. So we need to follow all these rules, not only just to follow the rules in order to manage the biomedical waste, but the main focus is reducing the health uh, of the humanity as well as the environment. It is explicitly stated that the rules, that these guidelines do not apply in hazardous chemicals, municipal solid waste, radioactive waste, uh, the lead acid batteries, e-waste, genetically engineered organisms, cells, hazardous microorganisms, and which are governed by different rules. So the rules which are given under the guidelines to 2016, they are not applicable to this category. Okay, the solid waste, which includes radioactive isotopes, lead acid batteries, e-waste. Okay, the rules which are related to that, the hazardous and non-hazardous category waste is not applicable to this kind of a waste. Next. Okay, then what are the silent features of the biomedical waste management rules? 2016, they have given the biomedical waste management rules in 2016. What are the silent features? We have some of the important features of biomedical waste management rules in 2016 with the same principles which you have learned, that is 3R. Okay, that is reduce, recycle, and reuse. So these rules ambit that has been broadened to cover the vaccine camps, blood donation camps, surgical camps, any other type of healthcare activity. Number one is same rules are applied which are being applied in hospitals. Anywhere that you conduct a camp, the same rules need to be followed. It could be a medical camp, blood donation camp, or a surgical camp, because the similar content of waste that we are producing even in the camps. Then within 2 years, the phase out the usage of chlorinated plastic bags and gloves and blood bags. So we need to phase out the things, like we need to buy off the things again which are chlorinated bags and plastic bags. Then on-site disinfection and sterilization of laboratory waste, microbiological waste, blood samples, especially blood bags, in accordance to World Health Organization and NACO guidelines. We have learned now the disinfection. So before we actually dispose the certain kind of material, we need to autoclave the things and then we send them for the disposal. So that need to be followed. That is on-site disinfection. All healthcare professionals should be trained and immunized on regular basis. This is very, very important. So irrespective of the profession or designation, everybody that is working under the medical point of view need to be trained, as well as need to be immunized with a proper hepatitis B and other COVID vaccines like that. So we need to be trained related to biomedical waste management training, as well as everybody need to be immunized on the infectious diseases. Next, we also have next. There should be a creation of barcode system for disposal of bags. The containers also should contain the barcode, like we need to follow the biomedical waste barcodes. Existing incinerators will meet the standards of secondary chamber retention time. Any cylinder or any incinerator existing cylinders are producing the dioxins and furans. So within 2 years, that chambers need to be changed. Then facilitate the waste segregation at source. Biomedical waste has been divided into 4 categories rather than 10. So basically, there are 10 categories. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 categories we have seen. While during the segregation, there are materials categorized under category 1, which related to the blood, and category 4 and 5 also related to the blood and body fluids. So not like following the 10 categories into 10 different bins. So basically, we have the 4 bins which we discussed, 4 categories which we discussed earlier, that human anatomical waste. Then we also have the sharps containing, and we also have the plastic, and we also have the general waste. Like that, basic 4 containers should be followed, and they should segregated. The waste should be segregated according to the bins and color codes at the point of source. Then authorization procedure have been streamlined. Like every authorization and renewal of authorization also need to be streamlined. and according to the practices that are happening in the hospital. Automatic approval of for automatic approval has to be done. One second. Previous. Okay, there should be automatic approval has been done, which is a bedded healthcare facilities, and one-time authorization has to be done to the non-bedded healthcare facilities. So what's the difference between bedded and non-bedded? Like you see the clinics like dental clinic, okay, you have the eye clinic, okay, where they don't provide the inpatient and they don't maintain the bedded, like it is not a bedded healthcare facility. Uh, Whereas bedded healthcare facilities, like they have the minimum 50 bedded or 100 bedded or 200 bedded, 1000 bedded, like that. So that's the difference. So they need to follow the authority and renewal, which is a bedded one. Non-bedded ones are one time authorization is enough. So that is a one more thing. Next. Then there are some new guidelines also established in order to follow the strict standards of incinerators in order to decrease the pollutant. Okay, the incinerator machines have newly designed, again they came up in order to reduce the dioxins and furans that are coming out of the emission and the combustion that is happening. Inclusion of dioxins and furans emission limitations. So we are trying to reduce the toxins which are released out of incineration. The state government will donate land for establishment of common biomedical waste treatment and disposal facility. Then its services of a common biomedical waste treatment facility is accessible within 75 kilometers. Okay, so every hospital should have a common biomedical waste treatment facility, the central one, not within the hospital. Within the hospital, we only have the storage. Okay, centrally within the city, we have the accessible center. That should be within 75 kilometers, not to be too long distance. Then no occupier shall install the on-site treatment and disposal facility. No hospital should have on-site, like within the hospital, there shouldn't be any treatment or disposal that is happening within the hospital. They definitely should go to the definitely should go to the center where they have the accessibility of giving the treatment. Then operator of shared biomedical waste treatment and disposal facility, which enables a timely collection of biomedical waste from the healthcare facility and assisting in training the delivery. So there should be a proper sharing needs to be done, how the treatment and disposal of each healthcare facility, which enable a timely, like 24 hours, 48 hours, 72 hours, like because it is only one center and there are different hospitals which are coming to that particular. So as we said, the 75 kilometers radius, not only one hospital, we have different hospitals. So there should be a shared responsibility, like they can conduct like Monday, one hospital, Tuesday, another hospital, with a 48 hours timeline. They can have a scheduled disposal and treatment like that. It will allow every hospital will have the access. Next. Next, there are other rules which are given in 2018. So the guidelines which we have seen till now are related to 2016. But coming to the 2018, there are some amendments. Amendments are like changes with improvements have taken place. Hospitals and nursing homes, clinics, dispensaries, veterinary institutions, animal houses, pathological laboratories, blood banks, and healthcare facilities. The clinical enterprises will be required to phase out chlorinated plastic bags. Okay, not only the empty plastic bags, the plastic bags are chlorinated priorly. Okay, and gloves also by March 27th, 2019. So this amendment is a new one. The plastic bags and gloves which you are using, especially the plastic bags, are chlorinated one, which dealing with other all healthcare settings. Then within 2 years of the date of publication, the Biomedical Waste Management Amendment Rules 2018, all healthcare facilities need to follow. Okay, those hospitals and healthcare facilities which are following the guidelines given by 2016 need to follow. Also, the amendments have taken place from 2018. Next. Okay, next we have from March 27, 2019, the operators of the biomedical waste treatment and disposal facilities must implement the barcoding and global positioning system. Okay, there should be a proper barcoding and global positioning system have to be followed for the processing of biomedical waste in accordance with the rules established by the Central Pollution Control Board. And the information received must compiled, reviewed, and analyzed. Okay, every information that we are receiving from the Central Pollution Board and all, that should be analyzed and compiled by the State Pollution Board, as well as the Pollution Control Committee and Central Pollution Board also need to be sent. So any changes that are happening within the healthcare facility and uh, need to be authorized by the pollution control boards and central and state both. Next one, we have amendments. The changes and trends also occurred in 2020 again. So on July 2020, the recent amendments have taken place, increased home acre and the recent amendments related to healthcare facility treating the COVID-19 patients. These 2020 guidelines have given with the influence of 2019, which happened the COVID-19 patients. So these instructions including improved home care. Okay, it's not acre, it is improved home care and healthcare facilities treating the COVID-19 patients. Okay, so PPE kits are the important ones. So the personal protective equipment have supplied to everybody within the hospital as well as the home care patients. Okay, the people who are getting treatment in the house, so they also need to have the PPE at their place. That is one of the example or one of the guideline that is given. And the revised guidelines also must be followed by all the laboratories, urban local bodies, as well as the quarantine centers, isolation wards, sample collection centers, and all laboratories, home care and healthcare units also. Okay, we have home care centers, we have healthcare centers. Everybody should follow the amendments which are given in 2020. What are the basic rules? These basic rules define the responsibilities of the people who are in the quarantine centers and all the wards, which I already mentioned. Okay, so this is about the amendments which took place in 2020, that is home care and with the supply of PPE. Next, last one, we have the maintenance of records. Yeah, maintenance of records. So this maintenance of record is not a new thing. It is given from the 2016 biomedical waste management rules. So every authorized person shall maintain the records related to generation, collection, reception, storage, transportation, treatment. Like we need to have each and separate register related to all the activities that are happening uh, of biomedical waste management. So for a period of 5 years, in accordance with these rules, guidelines issued by the central government and Central Pollution Board, as well as prescribed authority in the case of particular rules. So we will see what are the rules and amendments that are occurred. Next. Okay, so there should be a rule 4 and rule 14 stipulate the duties of the occupier. So the basic rules we need to follow, the uploading information on website of every every format we need to follow. So the uploading information on website. So how we are following, we have certain examples here. Contact address need to be given, number of beds in the particular hospital, contact address of the particular healthcare unit or healthcare setting, details like authorization body according to biomedical waste management, is it a which center of pollution control, quantity 5, that mode of disposal, then name or address of the central board biomedical waste transfer and facility, then captive treatment facility as well. Okay, and we also have monthly record and number of training conducted and immunization status. So all these things have been given. So every format will have the information related to the training conducted on the biomedical waste management, conduct the health checkups to all the medical people who are working, and maintain and update day-to-day basis of biomedical waste management register, reporting every major accident that is happening in the form 1, make an annual report available in the website, and record of biomedical or medical management also of the committee to monitor and review the activities which are happening related to biomedical waste management. So here every authorized person shall maintain the records related to generation, collection, reception, storage, treatment, and transportation uh, of biomedical waste. Okay, so there are different forms is given. Reporting the State Pollution Board, form 1 is accident reporting. Accident reporting is like any accidental spillage or the leakage of the biomedical waste out of the transportation machine. Form 2 is application of renewal. Form 3 is authorization, like you need to apply for the authorization and renewal of authorization, form 2. Authorization actual succession with the form 3. Form 4 is annual report, like annually how much amount of waste that is getting generated from the different healthcare units, and we need to report. Then form 5 is final appealing. So form 4 is final appealing. So here we have seen the different forms we can use in the prescribed format in order to report to the state pollution control board. So annual report is there, accident and incident reporting is also there. So basically whenever we are reporting, we need to follow the contain elements, that is particulars of occupier, quantity of the waste generated in kilograms per annum, details of storage, details of treatment, transportation, processing, disposal facility, details of treatment, training conducted to the biomedical waste management, details of accidentals occurred, details of emission and effluent testing. Okay, next we have the roles and responsibilities of the healthcare facilities under the typical waste management structure. So every healthcare facility should have this typical waste management structure, as you can look at the picture. So there is a person, hospital head and the administrative. It can be a chief executive officer or a chief operating officer, which is a hospital head and administrator, will have the responsibility of all the biomedical waste management that happens. It is you know the authorized structure that we are looking at. And under him, the hospital head and administrator, you also have the structure in your textbook, which is in page number of 45. Under the hospital head and administrator, we have biomedical waste management officer. Okay, under the administrator, we have the waste management officer. Under him, we have each departmental heads. Okay, the medical and dental head, engineering head, pharmacy head, radiology head, laboratory head, blood bank head, housekeeping head, canteen head, and laundry head. Okay, and all these people will have the connection. Okay, these are the actual people that maintains the biomedical waste and maintains the registered, monitor every work that happens. But they also should have the link to the other people who are involved, including infection control committee, the nursing superintendent, supporting staff like ward sisters, nurses, and lab technicians, hospital engineers and head of environmental services, administration and finances, and storage supervisor, hospital attendees, attendants, and ancillary staff and waste handlers. Okay, so it is a liaison, like this. The first structure which I've given, the head of the hospital and administrator. Under him, we have the waste management officer. Under him, all the heads of different uh, departments that we have. So they also have the separate linkage and liaison to all the people which I mentioned. Okay, so what are the responsibilities of them? I'll just read out, like the just focus on the picture here. The head of the hospital should be responsible for making and ensuring that obtaining a required approval. Okay, he will be looking after the approval has been taken place from the authoritative body, that is state and central pollution control board. Next, written waste management plan. So there should be a proper waste management plan which is written in the hospital. Everybody should follow the same thing. There is a policy. Representative of waste management team or clinical and non-clinical, so he also is responsible to identify the people who could be the responsible towards the waste management, handling, transportation, disposal. Everything should taken care of taken care by them. He is the one identify the people. He is the one should give the responsibility to that particular team. Waste management officer also should be well defined in organization to supervise and implement the waste management plan. So every plan that is making by the head or administrator should be followed by the waste management officer. He is also responsible for the allocating financial and personal resources. So he is also responsible for the money, material resources which need to be supplied in order to see that the plan has can be implemented. Head of the hospital make sure that monitoring the procedures are incorporated according to the plan. So they have to plan, like the person has to plan and see that implementation also acts or occurs according to the plan that they made. The next one, waste management officer. So he is responsible for day-to-day operations. Like the head is looking after and supervising, but every day monitoring has to be done by the waste management officer. Implementing waste management plan, ensure proper storage and controlling the internal waste. Like he should see that the larger waste should not be produced. Monitoring the on-site transportation and on-site storage, like within the hospital. Maintaining records in all stages, waste generation monitoring and monitoring of waste disposal. coordination with the inspections teams and authorities, and he is also should maintain the liaisons between all the people like infection control, medical superintendent, nursing superintendent, the laboratory superintendent, like he should maintain all the liaisons. Next, we have heads of departments. They have the responsibility, make sure that within that particular department, the segregation of waste is happening according to the color code, and the transportation is also happening with the sealed bags. Okay, sealed and storage procedure has to be maintained, coordinate with the waste management officer. So the heads should coordinate with the waste management officer should coordinate with the head of the hospital. Okay, and any mistake occur, they need to immediately report to the waste management officer. Then head of the departments also have the responsibility of conducting training towards the people, conducting the training among the people who are working under him within the particular department. Next, senior nursing officers should have a responsibility conducting regular training sessions to all the nursing staff, medical and paramedical staff as well, related to segregation, collection, storage, transport, disposal. Then she is also responsible, or he is also responsible liaison with the waste management officer, infection control officer, chief pharmacist, and radiation officer, and other departmental heads as well. Next, infection control officer, he is responsible for liaisoning the waste management officer and the departmental heads, and discharge the specific duties related to healthcare waste management, like identifying the training requirement according to the staff and grading. Okay, like there are some class 4 employees and there are professional and non-professional people are there working. So what kind of or what level of treatment has to be given to which kind of people need to be identified the infection control officer. And is also liaison between the departmental head and hospital waste manager officer, waste management officer. Hospital engineers, they help in maintaining the safety measurements and equipment used in the hospital. They are responsible for installing and operating and maintaining the on-site treatment facilities, like example, sewage, drainage, and autoclaving within the hospital. What treatment are happening, they are responsible for that. Chief pharmacist is responsible for managing the pharmaceutical waste. Okay, he need to identify which are the close to the which are close to the what do you call the expiry date of medicine. Then minimizing the waste and ensuring that safe management, and cytotoxic waste also is responsible for the chief pharmacist. Then supply officer will have the liaison between the waste management officer, and should continuously supply the waste management consumables like plastic bags, color codes. He is the one responsible for supplying all the resources related to biomedical waste management, treatment, and under the waste management every step comes. So he is a person responsible for that. Okay, next we have guidelines for barcode system. Next. Okay, so what guidelines we need to follow related to barcode system? So we have seen already what is a barcode and what is a biomedical waste management barcode is there. So biomedical waste management rules according to 2016 notified that in 2016 amendment have been done from the Protection Act, that is Environmental Protection Act in 1986, stipulated that there is a duty of healthcare facility to establish a barcode system for bags and containers. Okay, there is a biomedical waste symbol to be sent out to all the premises within the hospital and place them with the purpose. And it is also given in 2019 that the amendments have occurred that biomedical waste management rules have again changed with the little advancements, and it is also duty of every operator said by the Common Biomedical Waste Treatment Facility, that is CBWTF, to establish a barcode system. So like that, we have a CBWTF, and we also have the amendments which occurred in 2019. We also have the biomedical waste management rules guidelines given in 2016, and the Pollution Control or Environmental Protection Act, which is given in 1986. So all these people together have given the barcode system to give towards the plastic containers as well as to the bags. Next. Okay, so what do they do actually? So they help in this system would help the prescribed authorities in monitoring and implementation of biomedical waste management rules 2016. So what are the benefits of this barcode system then? So we can see the summary of these benefits. Number one, it ensures the biomedical waste is handled properly. Okay, Then the biomedical waste from the source generation to intended destination. So from the moment the waste is generated to uh, it reaches to the intended destination, to the treatment and disposal, a proper handling has to be done. So it is given by the barcode system. Then daily check on the occupier transportation involved in transportation of biomedical waste within the healthcare facility, as well as the transportation of biomedical waste from healthcare facility to the control board of waste treatment facility. Okay, from the hospital or healthcare facility to the control board of waste treatment facility. Uh, Throughout the distance, there should be a proper daily check, and occupier and the facilitator and transporter also should have an eye on it, the particular waste that they are carrying. Then preventing the proliferage of biomedical waste, like there is a spillage and proliferage of biomedical waste at the healthcare facility during the transportation of waste from the healthcare facility to the controlling board of waste treatment facility. Next, it also helps in keeping the record visits made by the CBWTF, a member of healthcare facilities, and identification of source of generation, like where it is coming from. Okay, we need to identify the source, and it creates the real-time online monitoring of waste generation, collection, and transportation, and quantification of biomedical waste generated, color coding, like color coding wise, you can have a track on it. Then handing over to the controlling board is also easy. Like you no need to tell that what is it, I mean, which type of a or which kind of a waste it is. Okay, the symbol itself says that is a biomedical waste. Next. Okay, then all these things, like any waste that is coming that we categorized under the 10 categories, we need to follow the guidelines given by 2016 related to the barcode system. Then the barcode system or the biomedical waste management disposal, not applicable to this kind of a waste. Radioactive waste, hazardous waste, chemical waste, lead waste, e-waste, and hazardous microorganisms. Okay, so on the whole, then we have seen that these are non-applicable waste, but what do they do actually according to non-applicability of the biomedical waste? Then what are the applicable things? Okay, it is given in your book for page number 49. Radioactive waste is a provision of Atomic Energy Act 1962. Hazardous chemicals is manufacture, storage, and import of hazardous chemical rules 1989. Okay, these are not come under the pollution control. They are coming under different acts. Okay, legally. Solid waste is the solid waste management rules 2016 under the act. Then lead acid batteries are covered the management and handling rule, that is 2001, made under the act. Hazardous waste is delete the highlighted portion and replace the solid waste, which are given in the rule 2016. E-waste is the electronic waste, which is coming deletion of the highlighting portion. Then hazardous microorganisms are, we need to manufacture, use, and import and export the storage of hazardous microorganisms, genetically engineered cell rules or microorganisms rules, which are given in 1989 Act. Okay, on the summary, like we have seen in this unit about what are the fundamental principles and guidelines and rules which are given basically from the World Health Organization in 1986, then 1989, then 2006 and 2016, and how the amendments have taken place in 2020 also due to the COVID-19. Okay, and we have seen all the guidelines related to the biomedical waste management process. We have seen related to the hazardous waste. We have seen related to non-hazardous waste and non-applicable items as well. Okay, in the block, yeah. So we have also seen what are the amendments or occurred in different years that I mentioned, and we also have seen rules and regulations followed in India, then other countries as well. Okay, so with this, we have finished the third unit, which is regulations related to the biomedical waste management. Thank you.